Hi everybody, and welcome to our webinar with Brad Beer on bone stress injury prevention in triathletes.
All right. Well, thank you, Robbie, and good evening, everyone. I will. I presume everyone can see the screen there. Okay. So, welcome along tonight, and the aim of this 1 hour together is to have an engaging discussion around this all-important topic, which is in the topic of bone stress injuries in endurance sports, but specifically in triathletes or endurance athletes, I should say. And the idea would be that if you spend an hour on this, that you walk away with a few thoughts in your head as to whether you're a coach, whether you're a junior, a senior, recreational, elite, a therapist. You fit somewhere in this ecosystem of triathlon and endurance sport, that you were just tuned in and aware of some of the key concepts around bone stress injuries. And thank you also, obviously, to Jason and Robbie at Triathlon South Australia and Victoria for pulling this together. I think it shows a great investment into the membership and abroad to put these on. Briefly, my background, just for context. I am 39, turning 40 this year, and I got into triathlon at the age of 10, turning 11. And I fell in love with the domestic, then televised triathlon series, the Grand Prix, and my triathlon hero was Brad Bevan. As a boy, all I wanted to do was race as a professional. If not, my backup plan soon became, physiotherapy seems quite interesting, given I spent a lot of time there as a junior. And then over the years, I competed, had a big accident in 1999, which resulted in a lot of fractures and a brain hemorrhage, and pursued university the year after, and it took me through with a physio degree. I've been working full-time clinically as a practice owner and clinician since 2005. And so here I am 15 years on with lots of time in the game and lots of experiences. I'm a titled APA sports and exercise physio. And one of the great joys I have professionally is being the head physio for the Super League Triathlon Series, which gives me a unique insight into the practices of, as we know, the planet's best male and female triathletes. I run myself, competing marathons. I've made a few ins and outs of triathlon over the years around children, and also have the pleasure of doing a bit of a physiotherapy consultancy at times to British Triathlon, Triathlon New Zealand, and Athletics New Zealand. Practice is on the Gold Coast, Pogo Physio, and I pretty much see bone and tendon injuries because I'm working with endurance sports all the time, whether it's running, surf lifesaving, or triathlon. Just a little bit of a background in terms of or context around trends. The endurance sports world has really exploded in the last few decades. If we look at some of the data around running, we've seen a 57% growth in running in the past 10 years. There's been a slight drop off in the last 2 years, but 57% is astronomical. This research comes from the biggest study in the history of running, the State of Running 2019. They looked at 108 million race results between 1986 and 2018, which is just astronomical. In terms of triathlon, there's been big growth since early 2000s, a bit of steadying off in 2013-14. And, reasons for that can be manifold. There's certainly been an uptake in more extreme events. So Ironman tri's been, when I say extreme, I mean, people looking for the next challenge beyond a marathon or a half marathon. So that's certainly spawned a lot of interest. A couple of quick trends that I think are worthy of mention. For the first time in the history of running, there are more female runners than males, only slightly. But as we've probably all observed, there's been a mass uptake of females in endurance sports, which is just fantastic. The average age of runners, which we can sort of translate over probably to a lot of triathletes, has increased over the decades from 35 years to 39 years. So we're basically seeing more women, more people, and we're participating into years that are later than previously, which I think is great given the manifold benefits we all know from endurance sports. we think about why does the prevention of injury matter? Well, that's really it, isn't it? Because we all know what we're like when we we can't exercise. Certainly, that's me. A little bit on how prevalent bone stress injuries are. So I like to just think about 1 in every 5 sports medicine injuries is going to be a bone stress injury. You can see from the literature here various statistics that range from 5 to 21%, and various other papers that are cited on this slide. But if you think 1 in 5 injuries are bone stress injuries, we can see that this is a common source of injury in runners and endurance athletes. Let's look at where these bone stress injuries can occur. And on the left, you'll see I've divided them into 2 groupings: low risk sites and high risk sites.
Brad,
So,
Brad,
sorry, yes.
Can I just grab you? I don't think the slides have come up. So can we just check that we've got your screen as well, please?
Yeah, certainly. Did you have the prior slides there, Robbie?
No.
How far back did you have?
We haven't had any slides showing
at all.
No. We've just had you on screen. I thought you were just doing your introduction.
Oh no, thanks for sharing out. So let's see what's going on here. Boom, boom, boom. Sorry, guys.
There we go. We've got your screen showing now.
All right. So I'll go to PowerPoint here. Everyone gets to see my messy desktop then. And view slideshow. All right. We'll just quickly. Is that okay there, team? Robbie?
Perfect.
All right. So here's just what we've missed. Just a couple of piggies. My life in pictures, and the trends. Sorry that people didn't have that on the screen, but there's a little bit on the trends. The funny pick about I'm afraid that if I give up running, I'll have to replace it with some violence. And here we're up to this slide here. All good there, Robbie?
Yep, all good. All good.
Okay, Brad. Excellent. All right, so there's low risk sites and high risk sites. The low risk sites you can see on the left are listed here, and this nice little picture. Any bone in the lower body is subject to potentially developing a bone stress injury. We've all heard of the shin bone getting bone stress injuries, good old shin splints as they're commonly known. If you get a shin splint on the inside border, that tends to be low risk. If you get a shin splint on the front of your shin, that can be high risk. High risk bone stress injuries, to clarify, can take longer to heal or recover from, and are not to be missed, because if athletes get it wrong, they can end up with stabilization through pins and plates and things, surgery. Low risk still, we've got the fib, that's meant to be the fibula on the side there, bit of a typo. The lateral malleolus down here, the shaft of the femur. I've unfortunately incurred a few through here, bone stress injuries over the years. The pelvis, the heel bone, and some of the things around the foot. Now, the high risk sites not to be missed, the front of the shin, the femoral neck as it hooks up here into the pelvis, and also not missing the navicular, the little blue lit up bone down here in the foot. If anyone's been watching the Michael Jordan Netflix documentary, I think about 3 episodes in, or 3 shows in, he had, it might have been 4, he had surgery on his navicular due to a bone stress injury. So they're the high risk sites and the low risk sites. A little bit on, how bone stress injuries develop. It's really important to understand a couple of key concepts. One is that bones are made up of an outer shell called the cortex, and then an inner matrix called the trabecula, spongy bone, and hard or cortical bone. Now, we can get bone stress injuries to either. We can breach the shell of the bone, or we can breach, if you like, the honeycomb of the bone. And how it happens is bone formation after we've run, typically we're talking about running here, or after we've loaded the bone, occurs at a slower rate than bone resorption. So we go out for a run, there is micro trauma or damage occurring to the trabecula and to the degree the cortex. And that damage, which occurs after every training session that involves load, needs to be repaired through our busy little cells repairing that bone. And where we run into trouble is if that repair is outpaced by the trauma, the accumulation of trauma. So we'll look at this on a continuum in a moment. But just remember, it's an imbalance between bone buildup and bone damage from loading. This is a histological slide of a microscopic view of the bone. And it's a key point I like to remind patients of, and also when I'm presenting to allied health professionals, is that bone is not a dead tissue. It's living and breathing. It remodels. It needs nutrients. I graduated university thinking that bones were just dead old levers, and boy, was I wrong. And I think it's worth remembering it's living, breathing tissue. It needs to be nurtured. In the sciences, we've spent a lot of time looking at tendons and muscles, but really bone management and the science behind bone is an area that I think we'll see a lot of in coming years. There's the little cells, without going into too much scientific detail here, but we can see the osteoclasts. They are the ones that break down bone, and then osteoblasts build up bone. This is an in-house document we use at the practice Pogo Physio, and I hand out to anyone that ever, or email if it's on a telehealth session, but I hand this out to anyone that ever presents with a bone stress injury. And what are we looking at here? We're looking at a continuum. So if you look on the far left and you imagine a happy face, this is an athlete with a happy face. They've got normal remodeling. The bone breakdown is being met with an appropriate degree of bone formation. What happens is if training progresses perhaps too much too soon, too little rest periods, too many hard runs in a row, we start to see accelerated remodeling where the resorption of the bone starts to outpace the bone formation. So just think of it like a bank account that's starting to be overdrawn. Then obviously, if we keep progressing, we start to end up in trouble. Now, this here should be a greater than sign, not an equal sign, but we start to run into what we call the pathology continuum. So over here on the left, accelerated and even normal remodeling, the athlete's probably asymptomatic. They're not aware they've got some developing bone stress. Where the symptoms start to occur is when you start to typically see a bit of fluid on the bone if you were to MRI a bone. And this is where radiologically the bone stress injuries can be classified into, we've probably all heard the phrase, a stress reaction. So it's a stressed bone, and they can go from grade 1 through to grade 2, through to grade 3, through to grade 4, which is a stress fracture line typically evident on MRI. And then if runners still progress, or athletes, triathletes, then you can certainly even see complete fractures of bone snapping. Fortunately, that doesn't happen that often, but stress fractures, grade 4 injuries do. If we think about what are the reasons why running-related injuries such as bone stress injuries occur, well, this is from the science, and there's a lot of information on this slide, but these are from systematic reviews. So they're, gold standard literature reviews looking at what the science says. Now, there's a couple of boxes here in the black ones that are highlighted. Medial tibial stress syndrome, that's shin pain. There's been lots of literature looking into the etiology or the cause of shin pain in athletes. Here's a couple of positive associations from the literature. You're at an elevated risk of getting shin splints or shin pain or a bone stress injury to shin or tibia if you've had a prior history of one. If you're a female athlete, if you've had fewer years of running experience. And the last couple down here, I don't place too much stock in, but if you use orthotics, if you've got an increase in body mass index, a greater navicular drop, an increase in external rotation of the hips. Now, those body feature things, I don't place too much stock on. I certainly do put a lot of stock on if there's been a prior history and if we're dealing with a female athlete or a beginner athlete. On the right side here, we can see lower limb stress fractures. And once again, one of the most positive correlations in the literature is that if an athlete has had a prior history of stress fracture, they are at a heightened risk of a further one. Now, this red box in the corner is important, and that is, as athletes, coaches, people in the field, we often want to go after the way an athlete moves or their biomechanics or the forces that they're dealing with as the villain of why someone often gets injured. However, literature is actually not in line with that. It's more in line with the overload of tissues, which we'll look at in a moment. This is probably the key slide of the presentation, in that it summarizes in one slide everything I'd like people to take into consideration, whether they are rehabilitating their own bone stress injury, whether they're coaching and in the care of an athlete, whether they're a health practitioner or an elite athlete, whatever it is. This is the key slide. So think of it as this. On the left, we've got biomechanical factors, load applied to bones. So this is all the things that can prejudice how much load gets put onto our bones. Now, when we run, we're talking about some high forces. For example, in the shin bone, the tibia, we can be dealing with 6 to 14 times body weight forces when we run. If we think about the joints, we can be talking about 5 times body weight at the knee, for example. So we're talking about lots of repetitive, quite high forces. It used to be thought that the forces we were subjected to as runners or athletes, triathletes, was the ground reaction force, a multiple of that. But they've actually found that the forces are much, much greater, and they're prejudiced by not so much the ground, but more, and the forces of the ground and the athlete colliding, but more the amount of force generated by the muscles on bones, for example. So on the left here, we've got all the factors that can contribute to the load on the bones. Training patterns, that's obvious. If an athlete's doing big hours on the road, we're talking about running here specifically, then there's a lot greater loading going through that runner's body. The way that runner moves, if there's deficits in control, then that can load up bones in certain regions. If the athlete has poor endurance muscularly, they'll get fatigued, and the shock absorbers from those muscles will be less. Footwear is controversial. There's potentially some play there. And running surface, I popped up there because people want to often go after the surface that we run on. However, it's not a huge player in terms of the biomechanical risk factors for bone stress injury. The big player there is training patterns and training loads. Now, that's where many people's concept of bone stress injuries stops, where we think, right, well, I've developed a bone stress injury, or my athlete's become injured, or my friend, they must have done too much. And that is normally always present, too much. And we'll look at the rule of twos in a moment. But if we look on the right side here, this is what I would love everyone to get a concept of. And that is that we're not just considering the loads on the bones, we need to consider the ability of our bones to be able to absorb the loads and prevent that accumulation of damage that we just looked at on that continuum. And what factors do we need to be mindful over here? I call these the biological factors. In other words, all right, we've got understand your training loads, but how well can your bones deal with that? We need to consider athletic history, medical history. We'll look at these in a bit more detail in a moment. The one I've circled here is really important, the two I should say. Energy availability of the athlete, the bone health of the athlete, and then things like life, stress, sleep, and calcium and vitamin D status. Let's have a bit more detailed look at each side of this image here. So remember, we've got the load on the bones and the body's ability to deal with bone loads. So on the left, we're looking at the factors that apply load to the bone. Biomechanics, I mentioned, are not a huge player in this. There's a couple of, cited literature reports there about the knee doing this, or a bit more adduction of the thigh. And if we appreciate that the way people move can alter the amount and the direction of bone loading. That's as far as it needs to go. The next little bullet point, training patterns. This is the biggie. We'll look at the rule of twos in a moment. Too much, too soon, too fast, etc. Interesting finding from the literature, adolescent runners who ran more than 32K a week had an increased risk of bone stress injury. Of course, if we're talking training, we can't talk training without talking recovery of the athlete. They go hand in glove, right? And then footwear, it's a complex topic, but it's not the big play up, and certainly not a format tonight to go too deep on that in. Just back there's a little note. 60% of all running, you could probably put triathlon there next to that, injuries are due to training errors. What are training errors? I like to think of it as this. This is the work of David Poulter, a physiotherapist from overseas. And if we forget the picks there and we just look at the twos, too quick, too strong, too long, too often, or a combination, and we pass the tipping point, and voila, either a bone or a tendon or a joint injury is sustained. We mentioned that recovery is obviously a key part of looking at the training loads. We're realizing in the science world and the therapy world and certainly the coaching world that rarely is an athlete overtrained. Most of the time they're under-recovered. For an expert edition of the Physical Performance Show, a podcast that I host, I interviewed Shona Halson. Shona was the former head of Australian Institute of Sport recovery science, went through about 4 or 5 Olympic cycles with the swimmers and the cyclists and a lot of the AIS athletes. And Shona said that in all her years at the AIS, she probably saw 4 athletes who were truly overtrained. The rest were just under-recovered. If we look at the literature here, this is a great study from Reiselton in 2013 and his colleagues, and they looked at nearly 500 Finnish male and female endurance athletes over a year. These were the sports: cross-country skiing, swimming and long-distance running. And how's this? Athletes with less than 2 days per week of rest during the training season had a 520% risk for an overuse injury. And then from the same literature, more than 700 hours during a year of training, i.e. greater than 13 hours a week, had a 210% or 2.1-fold risk of an overuse injury compared to athletes that did less than 13 hours. So recovery is huge. This sums it up. The only training we're benefiting from is the training we're recovering from. Certainly in my 29 years around endurance sports, this is something I never appreciated as a junior triathlete going through the ranks. I didn't appreciate it even when I made a comeback in the 30 to 34 ranks. But now as a physio and a Masters athlete, I really do recognize this truism. Here's that slide again. And now let's have a look at the biological factors or the ability of our bones to withstand the forces. What matters? Let's have a look. What matters is the athlete's history and their athletic history, I should say, and their medical history. So if you have an athlete, you're a coach, if you are an athlete, you know a training buddy that's had a prior bone stress injury, then that's a risk factor for a further one. From the literature here, 10 to 12% of those with a bone stress injury, track and field cross country, they sustained a second one within 2 years. So that's quite a bit. We need to be mindful that it's good for our juniors to be doing high impact, multi-directional sports such as basketball and things through their formative years, gymnastics, because we know that that's linked, basketball and soccer, for example. We know that that's linked with improved bone density through these children's development. Another key thing with the medical history is genetics. I spent time on a telehealth consultation with a sub-elite marathoner from Sydney today who's incurred a recent bone stress injury. It's number 2 in 12 months. And I asked her today, is there a history of low bone density in your family? And she said, yes, my mum has osteoporosis. My mum's mum has osteoporosis. So 60 to 80% of any of the athletes that we're coaching or working with, or as athletes ourselves, it comes from the good old genetic pool. I was quite devastated at 36 to find out after a lifelong, at that stage, pursuit of healthy habits that I had low bone density. And that certainly explained why I had a string of bone stress injuries from 30 years to 36 years of age. Medical history can include things like use of glucocorticoids, corticosteroids, cancer treatments, etc., which can, decrease the bone mineral density. Also, conditions like celiac disease and hyperparathyroidism, these can influence the bone health of an athlete. That's a paper that shows that we should be encouraging young athletes to participate in ball sports, jumping around, because it can increase the bone density and improve the bone geometry. Now, we're talking about these factors, these biological factors that moderate how well we deal with our training loads. Remember, there's two sides to the development of these bone stress injuries that we know are so prevalent. These are big areas: energy availability and bone health. We're going to go to that in a moment, but if we skip down there to calcium and vitamin D status, we need calcium. We sweat. When we sweat, we lose a lot of calcium. We'll look shortly at how much bone density we lose as we mature. Can be quite confronting, and so therefore we need to have ready stocks of calcium in our bloodstream at all times, more so if you're an athlete, more so if you're an endurance athlete than the sedentary individual, so our body doesn't have to source it from the bones. Vitamin D, of course, promotes the absorption of the calcium, and it's surprising how many people in our Australian society would be vitamin D deficient. I spent 10 years in a physio room, starting early, finishing late, but training on often either side, thinking I got plenty of sun, and I was vitamin D deficient for about a decade. So next time you get bloods, take a look at that vitamin D status, and if you're low, get out in the sun a bit more. Of course, you can supplement with it, but have a look at that underlined research stat there. 600% risk of stress fracture for female athletes who consumed less than 800 milligrams of calcium a day versus those that took 1500 or absorbed, or so I should say ingested 1500 milligrams. It's huge. This topic, energy availability. Remember, we're thinking about and looking at these factors on the right that influence our bones' ability to deal with our training loads. Now, this is something that is just a huge area. I won't do it full justice in the short time we have tonight, but I hope I can impart a few thinking points. What is energy availability? I might skip over a slide for a moment and come back in a second here, but this is a nice little picture from Dr. Nikki Key. Dr. Nikki is a sports endocrinologist in the UK, and let's take a look at this. Let's think about, we need energy balance. So energy to balance is in the middle here. That is, the amount of fuel we're taking on board is matched with the output through our exercise. So we have sufficient energy available for all of life's processes. Now, as athletes, we underestimate, and as people, how much fuel is required just for the maintenance of life, just to keep our brains full of glucose to hopefully make wise decisions through a day, just to raise our children, just to go to sleep and have our lungs and heart continue to respirate and pump blood around our bodies, just to restore the tissues from the day's load, leaving exercise aside. It is a huge energy cost that needs to be met. There's only one way to get energy in, and we all know what that is, and that's to eat and take on nutrients. So if we're in energy balance, and it's almost impossible to measure, even in lab environments, in research environments, then we're happy. We've got enough energy available for our training. What happens now if we go over to the right, if we double our training volume? Now this, as athletes, we can do quite easily. We can go from a 10-hour training week to a 20-hour training week like that, or 20K of running to 40K of running like that. Now, whether we think about this or not, but that requires a doubling of energy availability. And so often our eating habits stay similar. I eat, an egg on toast for breakfast and a bit of cereal or a shake or whatever. They're quite similar, even if we're in higher training at the time. And this can set up this condition of low energy availability for the athlete. Now, what suffers? Well, the training can certainly suffer in quality, but so can the health of that athlete. The bones will not be prioritized as well as they need to be. The tissues will not be regenerated as well as they need to be. And we can deal with this on a short-term basis, but we cannot deal with it well over a long-term basis. If there is an ongoing situation of low energy availability, the health of the athlete is going to be compromised as well as the performance. Trent Stellingworth, who I had the pleasure of talking to on another expert edition of the Physical Performance Show. He's the head of the Canadian Institute of Sport for Track and Field, dietitian and really well-renowned researcher. And Trent commented that if an athlete's in 100 grams of energy, low energy status each day, now 100 grams is not much. And if they did that over a year, that's like telling an athlete not to eat for a month. So why are we talking about this? Because if we have low energy availability, our bones are likely to be under bone stress and getting injured, and later on lead into health outcomes we want to avoid, such as osteoporosis. Now on the left, go far on the left, we've got energy balance and we've got increased training on the right. What happens to the athlete that's training? And like I mentioned before, they're not increasing their nutrition or intake as they need to for the increased hours. They're basically in a state of insufficient energy availability. And this can be on the left, you can see here, due to disordered eating. So these are intentional eating disorder. So we all know, terms like anorexia, orthorexia is, fussy eating. So that's what we'd term disordered eating. So, we've seen prominent cases of eating disorders and disordered eating in the news in recent times. Prominent shoe company programs, one out of the US, where one of the female athletes came out and spoke about some of the pressures of being a female athlete in that environment. But then there's a category which is not a greater concern, but something that I'm always mindful of, and that's the unintentional low energy availability status. And that's the athlete that, like I did for 10 years, went back to back with physiotherapy appointments all day, was training for endurance sports, was running on adrenaline, trying to make appointments back to back, and under fueling, and then training hard on top. Now, why does this matter? It matters because our bones can suffer. It also matters because our performance can suffer. Here's Dr. Nikki Key here, and she comments that an athlete will not reach potential as an athlete if they're in a state of low energy availability. So that's the aim of the game, right? To reach our potential. If we're in a state of low energy availability, we just won't get there, no matter how hard we try. The terminology around this, I'll just play this little clip and then I'll talk about the terms. Here's Dr. Nikki Key just talking about a couple of concepts.
So the three key behavioural things under your control are the training load, like we just went into, the recovery period, we've said how important that is, that's when the hormones really kick into action, and nutrition. So you have to fuel appropriately. Fuel for the work required is the quote that colleague James Morton at Liverpool Moors, he was the chief nutrition guy for Team Sky. So this concept of fueling for the work required, because if you are varying your training, then of course you're going to have to slightly tweak your nutrition to coordinate with that. So that is the good news. It sort of gives empowerment to the athlete. So the three key behavior.
So the one thing I want us to take away from there is from former Team Sky head of dietetics there, James Morton, and that is that we need to fuel for the work required. So if we've doubled the training, if we increase the training, as athletes, we better be matching it with an increase in energy. I often say to athletes that are consulting me for bone stress injury rehabilitation, eat more than you think you need. Jokingly, because I know this athlete really well, I've had a relationship as a professional helping her for years. I told a long course triathlete with a big smile on my face, of course, your homework is to go and eat a hamburger and send me a photo. So we've got to fuel for the work required. Now, this status of low energy availability has more contemporarily become known as this red S. Now, some may be aware of this terminology, and for others, it might be new. But red S, don't make it overcomplicated, stands for relative energy deficiency in sports. Some of us may have heard of the female athlete triad. That's now the sort of out-of-date phraseology, because guess what? Half of the world endurance athletes are male. So we see signs of the female athlete triad in the males, bar missing of menstrual cycles. So don't get too bogged down in this terminology, red S. It's simply an athlete in a state of low energy availability. Now, we might think, well, this wouldn't happen very often, but I put this slide together to sort of take from the literature. Track and field athletes, 18 to 58% have were operating in a status of low energy availability. Remember the problems there: poor performance, less than optimal, and risk factors for lots of health issues, including bone stress injuries. It's most prevalent among the endurance athletes. They found that low energy availability had been reported amongst 60% of elite, middle, and long distance athletes, 23% amongst sprinters. Next point, more common in females, 58% than males, 51% in endurance athletes. We might think, well, this doesn't bother the elites. Well, it does. Look at the next point. Elite athletics, the prevalence of low energy availability was 31% and 25% for female and male middle and long distance athletes. We're starting to get the picture. And then we might think, well, surely the East Africans are void of low energy availability. 18% of adolescents in Kenya, in elite Kenyan runners, compared to 2% of Kenyans who were not athletes. How can that happen? Because they're training so much, they're just not fueling enough. A 30% reduction in testosterone levels has been reported in athletes with at least 5 years of endurance training. That's a huge thing. If we have low sex hormone status, testosterone for males, estrogen for females, our bones do not get prioritized for health. So I think we're appreciating that one of these factors we need to consider for bone stress injuries is the health of the bones, the biological ability of that bone to be a happy, healthy bone. Now, how do we know if we as athletes or the athlete we're coaching or consulting as professionals has low energy availability? Well, the bad news, I should say, is there's no magic test. The good news is there are a few guiding lights. And these are the guiding lights that, there's formal assessments, the IOC have these screening protocols, and there's a LEAF questionnaire. If you're doing research, they probably have a place clinically and professionally. I look on the right-hand side. This is a little infographic I pulled together. These are called subclinical indicators. So if I have an athlete, or you are responsible for an athlete, or you know of an athlete that's had multiple bone stress injuries, I'm often sending them for blood tests to look at their sex hormone levels. We're looking for low testosterone, low estrogen as a signpost that their bones may not be as healthy as they could be because they aren't being prioritized. Reduced sex drive, that's a hard one to gauge, right? It's difficult. It can be awkward, but endurance male athletes, if they are not waking up with an erection, then they are possibly in a state of under recovery or low energy availability. Awkward, absolutely. I always challenge health professionals. If you're awkward with those type of comments, get out of the room and let someone that isn't awkward talk about those things. It's no good a bone stress injury rehabilitation taking place that deals with the training loads and forgets to consider these biological factors that are in many ways the bigger player, or as an equal player. For females, we're considering an absence of menstruation cycles. Once again, as coaches, as health professionals, these should be common conversations in the appropriate manner. If I have a female athlete come in with a bone stress injury, I am asking, how's your cycle? Is there any irregularities? Now, the oral contraception pill does throw a spanner in the works, so to speak, because that's a withdrawal bleed rather than a true bleed. So all sex hormones, estrogen, are down-regulated on the pill, which is a tale for another day. But we're looking for those things as secondary indicators. And of course, if there's been a history of bone stress injury. I really felt to put this slide up. This can start young. This is not something that starts in adult athletes. And these are quite sobering. I'm a dad of 2 beautiful girls, a 7-year-old and a 3-year-old. And it horrifies me to think that this can be what our kids deal with. Low energy availability may start young, and even in the absence of disordered eating. One study here in a female high school athlete showed a prevalence of low energy availability to be 31% in athletes. 1 in 3 kids were not getting enough fuel. And look at this, early attitudes on body type start young. It's a challenging space, one we have to confront. This last bullet point, a separate report of kids in this trial, there were 748 runners, identified the belief that being thinner leads to faster running performances in half of the girls and 2/3 of the boys. Wow. This is Ryan Hall. We probably know Ryan, if we're into marathon performances, Ryan's still the American record holder for the marathon, boasting a pretty swift 2:04:58. And I took this image, and this is his Instagram quote at the bottom. What a difference 4 pounds can make. In the picture on the left, I ran a 2:04 at Boston, the American record, at 137 pounds. In the pic on the right, I was 133. I ran a 2:18. And I didn't even look at the clock. You can see the difference. And on the right, he was intentionally trying to be lean, trying to be built like an East African. He's spoken about this. And his performances were through the floor. On the left, he wasn't worrying about that. He was just worrying about trying to stay in energy balance. On the right, he was in low energy availability. These are from the IOC, International Olympic Committee's papers around Red S. We can see on the left the effect of low energy availability on performance. Look at that. And on the right, we can see the effect on health. So we've got to remember, these are important conversations for not just the performance of the athlete, but their lifelong health. Now, if we're considering the biological risk factors for bone stress injuries, we need to think about sleep. Athletes who sleep less than 8 hours a night can have 170% greater risk of injuries than those that sleep for 8 hours or more. Now, of course, there's parents with young kids, there's busy work lives, there's COVID stresses. I never want stress to be sleep to be a stress for people. It shouldn't be that, but it's just a consideration we need to be mindful of. And university stress is very real, and university stress, for example, can make athletes more susceptible to injury, financial stress and pressures. We've got about 5 minutes to go before I throw over to some questions. So I'll try and race through these, but how do we know if someone's got a bone stress injury? Well, as a physio, there's a bunch of tests you can do, but the best thing we can do is right there on the top right is listen, and listen with intent. Don't interrupt, but listen. Ask the awkward questions about cycles, female menstruation cycles, libido, erectile function, and listen. Genetic history, the whole lot. I always have a high index of suspicion when working with endurance athletes. You just have to think that, first it could be a bone stress injury and then rule that out. There's a couple of misnomers about bone stress injuries, and there's a bit of detail here. I apologize, but these are infographics I've pulled together. 5 signs you might have a stress fracture. People think that they come on often slowly, but they can come on very, very quickly. You can be out running one moment and the next you're barely able to weight bear and you've incurred a bone stress injury. We need to think about how they present. So bones present differently to tendons. Bones ache after you've used them. Tendons are often stiff and sore 24 hours later. And often people say it just doesn't feel right deep in there, wherever they're pointing to. Look, before they've even said that, you're often cued into it if you listen in with intent. Of course, we can organize imaging. I'm sorry, there's a typo up there. That's not done through an X-ray unless it's been more than 6 weeks post a fracture. We will not see it on an X-ray. It's still something that gets done a lot, is an X-ray to query a bone stress injury. Bone scans are out, the good old bone scans. They still get done in certain ways at times, but the MRI is really the best accepted way to look at a bone that's under stress. What are we looking for on bones for MRIs? We're looking for fluid on the bone. So there's a grading scale, Fredrickson's often used, and the more fluid on the bone, the higher the grade bone stress injury. Remember, we looked at the continuum earlier. We can see cross-sectional images here of the femur, and here we can see an AP view of the femoral neck lit up there with bone stress. Recovery timeframes, everyone wants to know. Okay, I've got a bone stress injury to a bone in my lower limbs. How long is it going to take? Well, these are guides. This is from Native's work in 2013, and you can see here, the higher the grade injury, the longer the recovery or return to sport timeframes. These are the ones I tend to work off clinically. If you've got a grade 1 bone stress injury, it's 2 to 3 weeks, no running. Grade 2 to 3, 6 to 7 weeks. Grade 4, i.e. fracture, stress fracture, you're looking at 9 to 10 weeks. And then for high-risk sites, we might be looking at longer, such as the femoral neck. And it's a case-by-case basis that needs to be factored based on the history, etc. Recovery time frames are going to be prejudiced by things like bone density. if an athlete has lower bone density, it's been shown to increase the time to recovery. If an athlete's without menstrual cycles as a female, we're looking at longer recovery. If an athlete's got nutritional deficits, we're looking at a longer recovery. A couple of ones not to miss, team. Don't miss the front of the shin. Poor blood supply there, very poor healing. They can be a real challenge to manage. I've seen plenty over the, well, I say plenty, I've seen my fair share over the years, and they can be a real trick. These are huge in terms of misdiagnoses, and that is the femoral neck. Look up here on the top right, the neck of the femur. It holds the shaft of the femur to the ball, and we've got a couple of different types. We've got the compression on the undersurface and tension on the top side. If we've got a tension one, that is a high risk bone stress injury, higher risk than even the undersurface ones. They can split and go right through, and that's what we're seeing here with a pin. This is not to scare anyone, of course, but it's just to bring to attention if an athlete's feeling pain deep in the front of their hip, they're an endurance athlete, we need to have femoral neck stress reaction as a potential diagnosis quickly. Things in the feet can happen. The big ones in the navicular here, think Michael Jordan. These ones on the little toes can happen as well. There's a few funny little peculiarities there. The fifth metatarsal, for example. If we are looking at a runner or a triathlete with bone stress injury and they've had more than one, I am generally sending them for a bone density test to look at remember, we're considering the biological ability of the bone. We've got to consider the bone density. We'll get results back that talk about T-scores and Z-scores. T-scores are related to 21-year-olds. The World Health Organization thought that would be a good idea, as the 21-year-olds tend to have the highest bone density across a lifespan. Z-scores are matched to your age, so depends on if you're looking for a boost or not, but your Z-score is going to always look prettier than your T-score if you're past 21 years of age. Look, below it's teenagers, it's hard to get meaningful data, which can be tricky if you're working with an adolescent with bone stress injuries. But I am more and more sending endurance athletes for bone density tests. Of course, there's gradation that we see, and that is if you have bone density less than 2 deviations from the mean, you're classified as osteoporotic. Between -1 and -2, you're classified as osteopenic. Now, the spine gives a better indicator than the neck of the femur. So this is the 2 areas measured. The spine's normally a better indicator of bone turnover. Let's quickly touch on rehab. We're going to throw to a few questions in a moment. When we're rehabbing, we must consider those things we've just looked at, the factors. We've got to consider the training loads. We need to consider the athlete's bone health. I like to think of it very simply as a seesaw. We've got loading on the left and we've got the athlete's capacity to be loaded on the right. Think of loading as the stuff the athlete does. It can be standing on their feet all day at work. It can be running, of course. It can be all the other modalities, swim, bike, of the triathlon life. The capacity on the other side, think bone health and strength. Funny picture of an athlete working in the gym, a runner in Brisbane who didn't have access to the gym through COVID. That was his creation. So if we think about the training, the stuff that a runner or a triathlete does, we're talking about returning to run programs. 10% rule doesn't always apply. We'll look at that in a moment. We're looking at the volume. We're looking at then restoring terrain and then speed. Speed is last. I always say we want to get you back to full volume before we think about speed. It's a rule of thumb, but it's one that prevents the recurrence of bone stress injuries. We want athletes to be builders, not boom busters. Going too hard too soon. It's the art and science. I'll put my hand up as an athlete that's done it far too many times over the years, even with the knowledge I have as a physiotherapist. It's not easy. We all recognize that, and there's grace for it. Look, there's modalities like Denny's in there and the Alter G that can be used as a tool, but they're not always readily available, and you can successfully rehab someone back to running without an Alter G. Nice little picture to keep in mind. We want to be working in the green zone, not the red zones, not sitting on the couch deconditioning and not, completely overdoing it so we're completely cooked. How do we know where the green zone lies? Well, there is the art and science, isn't it? The 10% rule, it doesn't apply for runners that have really high mileage or triathletes, because the increases that can be tolerated might be much smaller than 10%. They might be more like 0.1%, because 10% of a 100K running week gets pretty big pretty quick. And likewise, the 10% rule doesn't apply for athletes who have really low mileage. It would take a long time to get an athlete up to where we want them if they're starting out. So just remember, it's not the golden rule. It's just a bit of I guess, not fallacy, but it's one of those things that's just sort of stuck around. It has some utility, but it's not the be all and end all. Now, if we think about that's, controlling training loads, we can talk about Strava data. We can look at training stress scores on training peaks. We can look at acute on chronic workload ratios. It's a big topic and not one to go fully into detail here on, but it needs to be considered for the athlete with return to run programs and beyond. If we think about how do we increase the body's biological ability to have healthier bones, we've got to consider strength and conditioning. Now, I like to break this down into the gym and at home. And really, every endurance athlete would be benefiting from spending time in the gym. As a physio, I'd prefer athletes to be sacrificing a training session for getting gym work done. It is that important. Bones like muscles. Where do we build up muscles? We don't build them up by doing more Ks running or riding or swimming. We build them up by subjecting to loads they're not accustomed to in the weight room. Specifically for bone density, deadlifts, squats, drop hangs, and strict presses are the exercises that increase bone density for the spine and the femurs. Many people mistake that all exercises are good for bone density, but they're the ones that affect those two big areas. We are remembering that running is a forceful activity. Look at the forces. Lots of force happening. And we're considering things like this, loading the bones. There's a lot of info on this slide. I apologize for that. It's taken from the Pro Bone study. And what I want people to take away is that if we want to improve the health of our bones, we need to subject the bones to loads that they don't regularly experience. So if we're running a lot, we are not building bone. The bones are not getting signals to get stronger. How do we get signals to bones to get stronger? Well, you can do what they did in the Pro Bone study, which is a gold standard paper in the world of increasing bone density for athletes. Over 9 months, they gave athletes, adolescents, 12 to 14, 20 counter movement jumps. That's just jumping up and down and landing with straight legs, 3 times a week, 3 sets a day. They then added weight and a few reps, and over time they increased their bone density. The takeaway, if you're a triathlete, if you're a coach of triathletes, if you're a health professional working with triathletes, we need to look at throwing in things like counter movement jumps into a training program. That can be as simple as, I like to give 10 reps a couple of times through a week, landing with stiff legs, trying to shock the bones to get signals to increase. Think about these things. High loads are key. Lots of repetition. The bone tends to go deaf to the signals after somewhere like 20 reps. And it needs to be regular and brief. So jumping off stairs, such as Belinda Beck comments here, a bone professor from Griffith University, one of my former lecturers, is a great strategy. I tell triathletes and runners, if you see a step, jump off it and land with stiff legs. If you've got kids, celebrate when they jump off high things and land. That's great signals for the bone to get stronger. Running drills, a bit of footage. I wanted to play the video, but I couldn't get it working there in time. But this is some drills from the Ethiopians. These are great ways. We don't have to do the Ethiopian drills. These can be just done at the track or before a run session. Throw the body around, subject it to some different movements. I even thought, like for swim sessions, 20 counter movement jumps, how fantastic for our triathletes before they swim. Get them to jump and land awkwardly 20 times. Great way to warm up. A couple of things about cycling. Credit to photos from Super League here as well. Definitely not ones I shot. Cycling is non-weight bearing. So when cyclists crash, and there's a high prevalence of poor bone density in elite cyclists, one paper found about 48% of Division 2 cyclists had osteopenia, osteoporosis in their spines. So if we're riding a bike a lot, we are not weight bearing. We're sweating a lot, losing calcium. We need to be ingesting calcium, making sure we're meeting the 1,500 milligrams a day and doing strength and conditioning work. It's not surprising when a cyclist crashes that there's often multiple fractures. We often attribute that just to the force. Also consider, if you've done a hard bike day, don't go and back it up necessarily with a hard run if it can be avoided, because the muscles are probably fatigued and won't help the bones as much with shock attenuation. That was me yesterday. I'm coming back from a bone stress injury, and I did a hard ride yesterday up Springbrook on the Gold Coast, and I was going to run Sunday Arvo 5K, and I thought, you know what, I'm going to wait till this morning. Building bone does not occur through running. That's a myth. Now, the younger triathlete, the Masters athlete, and then we're going to take some questions. The younger athlete, super passionate about this. We've got to make sure they're getting enough fuel. Fuel for the work required. It's a myth that kids shouldn't be doing strength and conditioning. It doesn't stunt growth. It doesn't affect growth plates. Think about low energy availability. Coach them that they do not want to be lean all the time, and get them jumping off things, and hopefully not specializing in sport too early. Expose them to as many sports as we can. The Masters athlete categorized as plus 35. Think about this. Bone density is going to be less. The strength drops off 30% from 30 to 60 years of age. Men experience 42% trabecular. That's the spongy bone loss, and 15% of the housing of the bone before 50 years. Women experience 37% of the spongy bone and 6% of the casing before 50. Look at that drop off. Now look at this, what happens to the bone mass for males and females beyond 30 years of age. We can really see how it drops off. And those different categories represent high levels of physical activity and genetics. So the point is, there's a big drop off after menopause for women, and men are experiencing a loss of bone density as well. So it's really important we try and get our juniors to hit peak bone mass as best we can. A couple of case studies we won't go into. And we will jump over to some Q&A. This quick note here. This is Eloise Welling. She talks about it openly. We probably recognize her as one of our great runners, 10,000 meter finalist at Rio. Eloise had 10 bone stress injuries over 11 years, missed 2 Olympic Games as a result. This was that brilliant, beautiful photo from the Com Games in 2018 where she hung back with the other Aussie girls and waited for Shaka, who was, I think, the Ugandan runner who trotted in a bit later. And I put that up as an encouragement. People can get pretty down about bone stress injuries, but you can find a way through, even with, as Eloise talks openly about, some background eating disorder stuff and low density. She was diagnosed with osteoporosis at, I believe, 14, 15, 16. You can still go on to perform at your best. You just have to think about a few things. Vincent Lewis, we all recognize, our current world champion for World Triathlon Series. Vincent spoken on the podcast actually about this before the London Olympic Games and Rio. He had tibial stress fractures in both legs. London, 2 of them. I think only 1 before Rio. And that's when he was running 160K a week. He joined Joel Filiol's squad, runs 100K a week, and he's had an uninterrupted process since. Johnny Brownlee, well reputed to have had multiple bone stress injuries, and on the Physical Performance show, Johnny gave these as his tips. He said, I realized I needed to sit down more, stop tidying up my socks and cleaning my bike all the time. Have a rest day. Make sure we prioritize strength and conditioning. And one of his big take-homes that led to a stress fracture ahead of Rio, not being lean for too long. Resources, you'll find me on Facebook every Monday doing some live Q&As, except for tonight. Telehealth's available through the clinic. Great for bone stress injuries, the book, etc., and social. So, Rob, I'll hand back to you for some Q&A.
Thanks very much, Brad. That's been fascinating stuff, and certainly from a number of questions which have started to come through at the end here, and also all the questions which were sent in beforehand. Clearly, bone stress injuries and bone health is a massive issue within our sport and endurance sport in general. And I was just amazed at the number of people who were commenting on the number of stress injuries that they had occurred. So, multiple repeated injuries that individuals had suffered, which is quite distressing to hear when you're trying to enjoy your sport and have fun in the sport, isn't it? So,
yeah, absolutely. And the reason why I felt so passionately about hopefully instilling just a few key thoughts is not to instill fear, but just a little bit of awareness, which can, make such a huge difference to being sidelined or being out there and active.
So with that in mind, what are the practicalities that you would say to people? What would be, if you're an athlete or if you were a coach or a parent of a junior athlete, what would be the very early markers that you would look out for where you think, I need to look at this a little bit more?
Yeah, the big one, Rob, is repeat bone stress injuries. It's not enough just to say, well, they've overdone it again. I consulted with a junior Australian champion just a few months ago who had 8 bone stress injuries in one foot, and it came on quickly after a hard brick session. It's a case of, okay, 8 in one foot. We probably need to lean in a little bit deeper than just looking at, a build up of cumulative damage through training load, which is not the coach's fault. It's the art and science, right? We don't know where that magic line is at times. So that's one indicator when things just don't seem quite right, or there's been a recurring history, Rob, of bone stress injuries. We have to look beyond the training load, and we have to start thinking about these other biological factors.
So is there anything particularly you'd be looking out for to prevent a minor stress injury from graduating to a grade 4 stress fracture, for example? Is there any sort of red flags during training sessions that you would be specifically paying attention to?
Yeah, great one, Rob. I mean, yes and no. I've consulted with athletes who have gone from absolutely nothing to, look at Jan Frodeno as a well-reputed example. He raced the World 70.3 Triathlon Championships in South Africa, won the race, one of the great races of all time, returned to Australia, Sydney. He talks about it. He went out for a run of the night after a flight and he fractured his sacrum. So, there's lots of examples of it coming on quickly. So that's the no part, Rob, is sometimes you don't know where you're up to on this bone stress continuum beneath the surface often. Many times you do get indicators like you just questioned. So the athlete will feel a bit of an ache in the front of their hip that increases with activity. It's there a little bit, it's getting worse. Okay, I better take heed. The athlete will know that their shin's tender to touch. It's a bit achy overnight. It's getting a bit sore after training. The athlete will know their foot doesn't feel quite right. And if it's a triathlete, which obviously it is, we're talking endurance sports, it would be a wise athlete that wouldn't just push that under the carpet and just go about their business. They'd talk to their coach, they'd mention it, they'd back off quickly and early, just miss a session, miss a run session, see what happens to it. They don't have to run to the therapist whenever there's a slight concern, but think about the time lost through not backing off versus pushing through. And look, I've made my own errors with that as an athlete many times over, so I'm never judgmental of that, but that's probably a few little key tips, mate.
So the non-negotiables which you kind of discussed there that are often talked about in endurance sport, about fueling correctly, recovering properly. Would you say those are the biggest things you can do to prevent bone stress injuries? Yeah,
definitely. Just be mindful that if you're looking at your overall training hours, which is easily calculated with all the performance management systems we have these days, Training Peaks or Strava, we can easily see how many hours we've trained for. If we've gone from 5 to 10, reflect. Did we ingest double the food intake, double the caloric intake? So fueling for the work required is key. It's just so easy to not change eating habits, but change training habits. And if we think about that beautiful diagram from Nikki Key, we will find ourselves in a state of low energy availability, and there will be, unfortunately, consequences for that performance and health. So yes, fuel for the work required. And then Rob, as you said, recovery. It's the art and science. It's the pursuit. We all want to train hard. We want to train progressively. But I have really just appreciated more than ever, particularly as a physiotherapist, a sports physio, and as a Masters athlete, we are only benefiting from the training we're recovering from. Joel Frill, the founder of Training Peaks, on this week's expert edition of the podcast, he commented that training is just the stimulus to adapt. It's the rest, the recovery, that is where the adaptation takes place. I remember Michael Phelps's coach saying something similar. Michael gets fitter after the session, not during the session. So how does that play into this? Well, after a hard run session, our bones might be in bone resorption mode for 4 days. Some runners or triathletes might be in bone resorption with that micro damage for 2 days. It's impossible to know. But there's some athletes who are going to need longer between hard running sessions or long run exposures than others. So unfortunately, it is often getting it wrong to then learn from. But, they're the two variables, the recovery and the fueling. They're so key.
So that leads quite nicely into a question which came through, which has been asked in regards to how you're measuring the load on returning to triathlon following a bone stress injury. So they're asking in regards to whether you look at volume, time, distance, intensity, or TSS, one of the Training Peaks metrics. So is there any... I guess from what you're saying, it's the art is kind of understanding all of those different pieces of the puzzle. But is there any one component which is a bigger indicator than others?
Yeah, I think great question too. The number of loading cycles is key. So the number of loading cycles is a variable correlated with the length or duration of we'll talk running here, of the running session, because that's where we get obviously the greatest bone loads from. So I will always want an athlete or triathlete, and this is my role as a sports physio, is I try and get them back to close to their ideal or normal, if you like, volume. And then I'm returning them to the hands of the coach to take over from there. So I like to not focus on intensity at all while someone's going through a return to run phase. Intensity is out the door. It shouldn't be factored in until the volume's restored. So that kind of makes it easy to quantify. If we think about the number of load cycles, if we run for an hour at say a cadence of 90, you're looking at 5,400 load cycles. If you consider the shin 6 to 14 times body weight, we're talking about a lot of load. So I like to coach runners and athletes, triathletes, Rob, around the concept of when we're returning to running, we're going to measure the time you're running for. And we need to think like a bone, remembering that it's getting damaged each run and then it's repairing. We don't know how long you need to repair. So we need to start with walk running typically. It's not sexy. No one gets excited about it. But it's what I call tissue training. It's tissue training for the bone, and it's distinct from fitness training. So I'll get triathletes to write this down on their program. This is tissue training, not fitness training. Think like a bone. They have a laugh. I have a laugh, but it hopefully drills the point home that it's just steadily built up looking at the volume.
Just sort of following on from that then, if we're looking at the measuring the load, making sure that we're not doing too much. Within the sport of triathlon, obviously we've got 3 different sports that we're trying to train in. Can we use that to our advantage in regards to trying to stay healthy and avoid these injuries?
Yeah, it's beautiful. Absolutely. And that's, I think, where as triathletes, we can celebrate. As a triathlete across any distance, recreation or elite, you're not going to be typically doing the loads that the one sport athlete would, the training hours. You're not running 160 kilometers week in, week out. Vincent Lewis tried that. It didn't work very well for the best in the world. We're running lesser volume, for example. And so we have to do that to fit in the other 2 disciplines. And the beauty of that is, we get that cardiovascular fitness, physiological stress through biking and swimming, whilst our bones are getting longer recovery time frames. So, for runners that are having recurring bone stress injuries, we're often bringing cycling in as a way to still give them a cardiovascular stimulus, but allow their bones that much longer between sessions to hopefully not go along that continuum. So yes, Rob, being a triathlete, it can be a real advantage.
We've got a question here from Stephen, who's obviously suffered a stress fracture himself, and he's saying that he has residual aches and pains. It's now healed, but the occasional aches and pains still remain in the same general area, which is not enough to prevent him from running, but is concerning him a little bit. Are residual aches and pains just a fact of life after a bone stress injury, or do we need to be saying to Stephen, you need to go and look a little bit deeper with that?
Yeah, look, Stephen, thanks for the question, Rob. It's a great one. This is a really tricky little area. Even with a bone that's well healed, if you want to term it like that, it's gotten back to the far left on that continuum. It's happy. It's not symptomatic. It's not sore. The runner can hop on it, move with confidence. Even with those runners, I asked one of the Canadian elite triathletes at Super League last year. He had a femoral neck stress fracture, how long he was aware of a bit of awareness in that area for after the injury. And he said 6 months. He still felt like he was aware of it. Now, some of that's hypervigilance. We're always going to feel quite vigilant when we return from a bone stress injury. Is that what it should be doing? Is that too much? We're kind of monitoring it with vigilance. You can't circumnavigate that. That's normal. That's healthy. It's the body's effect, the body's mechanism to protect us. But if an athlete hasn't done the required time off their legs completely, and bone stress injuries can be so hard to treat at times because the absence of pain does not mean the bone's healed. So we often get 2 weeks after a sore shin and we go back and it aches again. So Stephen, if that's your situation, for example, most of us have been there, done it, then that is a pain that you need to take heed of. If you have done the time off required based on the grade of injury, then you can more confidently progress knowing that it's probably just a bit of, I almost call it phantom bone pain, but I'm very reluctant to use that phrase because I don't want people to think that they don't need to take those signs seriously.
We've got a question here, which I think is really, really important because it touches on the psychological aspect and certainly with juniors as well. Because alongside the physical aspect, there's going to be that concern that they're going to injure themselves again, and also just that anxiety and perhaps fear of pushing themselves to complete the training. So I've got a question here in regards to a junior athlete who's been out from a stress fracture. And they're asking what are some positive ways to help them gain confidence to return to the sport and help them overcome the reluctance or anxiety.
Yeah, overcoming that reluctance and anxiety. Another great question. Yeah, athletes are good at dealing with pain, aren't they? We all are. We don't do the sport we do because we don't like physical pain. It's the psychology that often is the harder part to deal with. As you mentioned, Robbie, the anxiety, the reluctance, etc., the fear. And I've made peace after 15 years of being a physio with the fact that there really isn't anything an athlete can do other than be reassured that they've done the work they need to commence their return to run program, hopefully confident in the team they have around them. How can that confidence be engendered? Well, that's the therapist talking regularly to the coach and the coach talking to the therapist and the parents being if it's a junior, that holistic care, which I think there should be a given no matter where or what. But they can be reassured from that, but they've still got to go through, as an athlete, we all have to go through that fear and uncertainty and anxiety. And we can only get to the other side through going through the middle of it. So hopefully we're confident in the work we've done and that we've had a good thorough look at things, and we've been doing the things. So the athlete that's taken time off but hasn't put any emphasis on strengthening up around the area and the whole running kinetic chain, we know when we've taken a shortcut, and that's when we're a little bit more anxious. So tick all the right boxes, proceed with confidence. I'm often getting runners, Robbie, on their run programs. Sorry, when I say runners, I'm talking about triathletes, of course, as well, to run with confidence. There's going to be vigilance, hypervigilance, but run with confidence. This is an appropriate program. We want to make a program not too overzealous. We don't want to make it too underdone. We want to find that middle ground, that green zone. And that would be my suggestion. It's not something easily that can be overcome other than going through it.
Sort of stressing the importance of a proper rehabilitation program, and then that will breed the confidence to gradually increase the loads and the training stresses from there.
Yes, absolutely.
So there's a couple of sort of health related questions here. We've had a question from someone who's returning to running following cancer treatment. And they're just wanting to know if there's any specific things to watch for when coming back into the sport. They mentioned they've had quite a lengthy time away without saying exactly how long, and obviously quite a traumatic event, having gone through cancer and received treatment from that. So is there any extra impact or risk associated with that, and is there anything specific they should be looking out for?
Yeah, well, it certainly is a major life event, and cancer treatments, radiotherapy, chemotherapy, certainly can have adverse effects on bone health. So I've certainly worked with multiple endurance athletes across my physio career who have returned from cancer treatment, and in more cases than not, their bone density has been reduced. So it's been aware of that, and also the deconditioning that tends to happen through a course of cancer treatment. The tissues get deconditioned. That biological ability is therefore reduced of the bone. Let's think Eloise Wellings. We can get it right. We just need to make sure I'd be wanting to get, for example, that athlete a bone density to check on that. That's often done post cancer care anyway, and proceed wisely from there, thinking about both sides of that ledger: the training loads, the biomechanical factors, and building up that capacity, strength and conditioning in the gym. It doesn't have to be complex. It's as simple as the capacity has to be greater than the training loads at all time through an athletic journey.
And following on from there, we've got a question which has come in regards to taking the pill to regulate hormones and periods in young middle-aged women. Is there the question mentions that previously it's been found to assist with bone health. Is that the case, or would you see it to be more detrimental to bone health?
Yeah, and this is getting outside of my scope of practice as a sports physio, but obviously it's something that we need to be across for when we're taking a history of a female athlete with a bone stress injury. Is the menstrual status, and is that being modified by the use of an oral contraceptive pill? So the key thing for us to be aware of with oral contraceptive pill use is it down-regulates the sex hormones. So it adjusts it down a gear. And it might be the case that whilst a junior athlete or a senior athlete that's using the oral contraceptive pill is using the pill, that their bone density isn't going backwards, for example. The challenge can be when they come off that and their body's trying to find their new normal. So there are, my wife's a medical doctor. I've spoken at length. She's an integrative doctor, so works with hormones, and I've spoken at length with my wife about this. there are medical times when the pill needs to be prescribed. So I'm not dismissing that. However, there are also considerations longer term for the health of the individual post the pill use being stopped. So the take home there is we really can't get an idea when someone is using the pill of bone density, because it's a false environment, and we've got to consider it coming off the pill after the medication ceased.
Thank you. So we'll run through a few questions which have come in via the chat room. First one is from Rob Hill, Victorian coach. Hi, Rob. And Rob's asked, is there any evidence that strength training with heavy weights reduces risk of bone stress injury? You touched on strength and conditioning in the gym, but Rob's asking specifically around heavy weight training.
Yeah, Rob, great question. And this is the good news story. Yes, absolutely. If we want to grab an athlete's attention, we just talk performance, right? Strength and conditioning will increase performance. If we talk running, it's easy to do research on runners. Strength and conditioning increases 5K time trial performance, decreases fatigue, produces more power, more force, all of the things. So yes, there's the performance side, but then in terms of the reducing injury side, yeah, absolutely. There's lots of evidence from the literature around strength and conditioning, reducing bone stress injuries, and improving the bone density of the individuals doing that strength and conditioning. There are papers that show that, the Pro Bone study, for example, looked at that counter movement jump, which is a form of strength and conditioning. But in the gym, Belinda Beck on the Gold Coast has done a body of work that takes even known osteoporotic mature people in their later years, puts them in a gym, gets them doing deadlifts and squats, strict presses, and they track their density over time. Now, like anything, there are responders and non-responders and lesser responders. It's like any training stimulus. Some have really big swings in bone density, others a little, some not much, and others nothing. So the good news, though, is, Rob, yes, absolutely, getting in the gym and getting strong is a lifelong habit that should be part of every endurance athlete. Now, I know we're under time constraints often, but I think the health and performance benefits of including some gym work, and you can get so far at home doing home circuits, but to get the heavier loads that we need to expose ourselves to, we really do benefit from that heavier load you can find in a gym. So, yep, plenty of evidence, and yes, reducing injury is one of the benefits.
Now, I'm conscious of time, Brad. So I've got a couple more questions that I just want to ask, but then I think it'd be really good if we can work out a follow-up to this, because some great questions have come in, and I think there's going to be lots of extra bits and pieces that we can do off the back of this. But just to cover a couple more questions, there's some similar bits coming in from Una and Dan. Una asking about getting a bone density test, even if there's been no issues so far, for female athletes over 50. And Dan's asking about blood tests, whether you'd recommend them for athletes to regularly check their health markers. So I'm guessing looking for ways to pick up potential problems before things get symptomatic.
Yeah, and they're both great questions, Una and Dan. Una, yeah, I'm stumbling here because you could either do it or not do it. There's nothing to be lost by doing it, apart from a trip to the GP for a DEXA scan referral, the time and cost, etc. The cost fortunately is Medicare rebated. There's normally an out-of-pocket of some figure, but we're not talking about, for example, the cost of an MRI. I really think that, yes, Una, as a 50-year-old female, you want to get an idea of your bone density. It saddens me when people find out 10 or 20 years on that they're on a downward trajectory with their bone density, which unfortunately, like at a lump it, we all are, and end up past that peak bone mass phase of life. And it's often too little too late. So yeah, Una, I would suggest you get one, particularly if you're an endurance athlete. Now, that doesn't mean every endurance athlete on the planet needs to go and get a bone density, but certainly 50 plus, certainly female 50 plus, it would be indicated. And then Dan, blood tests for athletes, it's a similar type of thing. And as you phrased it, Rob, we're trying to pick up problems before they exist. We don't want to create anxiety around these things, but bloods are a great way of, really the only way of getting a look at the sex hormones, bar those secondary indicators, lots of lack of sex drive, etc. So knowing that if you've been involved in endurance sports for more than 5 years, you've 30% likelihood of having reduced sex hormones, then yeah, keeping an eye on those could be a wise strategy if we then think further ahead to the effect of that on bone health.
Well, brilliant, Brad. Thank you ever so much for your time. There's been a number of requests for slides and exercises. So I think if we have a chat offline, we can look at extra bits and pieces that we can do for people. But if you were to give people one thing to take away from this evening, what would it be?
Oh, Rob, one thing, I hesitate, but I'm going to say it: eat more than you think you need.
I think that's probably a great message out there, and one I will certainly take to heart. I don't need any second invitation to do that, Brad. So on that basis, thank you ever so much for your time. Thank you ever so much for everybody who's joined and watched this evening.